In this video, we will talk about anti-anginal drugs. The classification of anti-anginal drugs are as follows: nitrates, beta blockers, calcium channel blockers, potassium channel block openers, funny current blockers, metabolic modulators. Okay. Nitrates for acute attacks, sublingual nitroglycerin; for prophylaxis, nitroglycerin, isosorbide mononitrate, isosorbide dinitrate. For beta blockers, we use metoprolol, atenolol for anti-angina action. Calcium channel blocker, verapamil, diltiazem. Potassium channel openers, nicorandil. Funny current blockers, ivabradine. Metabolic modulators, trimetazidine, ranolazine.